Up to 150,000 healthcare workers will be brought online across Australia to reduce the strain caused by rising Omicron hospitalisations. The additional measures come on a day the country recorded its highest daily number of COVID deaths, and Victoria activated that emergency plan. But the state's nurses union says hospitals need urgent military support to keep running.
A system under immense pressure.
Staff are exhausted. This is very much a marathon and not a sprint, and we've worked really hard to put in sustainable processes.
Not helped by patients presenting for the wrong reasons.
We had a patient last week that was desperate for a PCR. They called 000, called an ambulance under the guise of having chest pain. They presented to the emergency department and were fast-tracked down to a resuscitation room, at which point they declared that they didn't have chest pain and they really wanted a PCR and wanted it quickly. That is an unbelievable misuse of resources.
Up to 150,000 healthcare workers will be brought online to reduce the strain caused by rising hospitalisations from Omicron.
This is the first time that the health system has come under pressure, really, to the extent that we're seeing in the last week or two.
The Health Minister has activated the private hospitals agreement, making another 57,000 nurses and 100,000 other staff available to respond to workforce shortages. The National Medical Stockpile is also being opened up, providing states and territories access to a strategic reserve of supplies. 10 million units of PPE are being sent directly to aged care facilities, including another 3 million rapid antigen tests.
This is the moment for which we have prepared over 2 years, and enacting those elements is an important part of providing that hope and confidence to the Australian public that it's difficult, but we will get through it.
When people saw Scott Morrison there on TV being flippant, saying we're living with COVID, we're taking wickets with the virus, they were entitled to be quite angry and frustrated at the failure of this government to put in place the mechanisms that were required, to put in place proper testing regimes, to look after the workforce.
The healthcare crisis peaked in Victoria, the state announcing a code brown for its hospital system after record high hospital COVID admissions and wide-scale staff absences. The last code brown was during the thunderstorm asthma event in 2016. It means each hospital system will be able to postpone or defer care which isn't urgent, and will apply at all Melbourne and 6 regional hospitals.
There's a huge demand. We are concerned about what this also means for the retrieval of patients, and we're already getting reports where the retrieval of patients, maybe non-COVID related, are being much more difficult to manage. It's more difficult to find a bed.
Health services under the code will be allowed to discuss cancelling planned leave with their staff.
We know that there is no surge capacity in relation to rural, and we're already seeing that with a lot of rural clinicians already cancelling their leave, working extra shifts, working overtime to meet the demand.
In Victoria's latest reported figures, there's been 20,180 new cases of COVID and 22 deaths. Nearly 5.3 million Australians have received their booster shot.
I said on the weekend, and I stand by those statements, that we are either at or close to the peak of this wave in certain states. Some states are lagging a bit further behind.
Anna Rawlings, Sky News.